Allow me now to invite to the podium the U.S. Ambassador to Tanzania, Ambassador Dr. Michael Battle, Senior, to reflect on the support of the United States of America in the health sector here in Tanzania. With your permission, and as it comes, ladies and gentlemen, let's accord him a big round of applause. Naomba tumpigie makofi mengi Balozi. His remark will be followed by the remarks from the Minister of Health in Zanzibar. We are looking forward to your speech as well. Karibu Balozi.
All protocol has been observed, but I must always acknowledge the presence of the Prime Minister and of the Minister of Health. The United States government is honored to have a long-standing partnership with the government of Tanzania that spans more than 6 decades. Beginning prior to the time that Julius Nyerere was president of Tanzania, and prior to the time that John F. Kennedy was president of the US. The two of them met when Julius Nyerere was an IVLP participant in the US, and John Kennedy was a senator from the state of Massachusetts. In about 2 years after they met, the two of them were presidents of their respective countries. We are two countries which desire the same thing. Tanzania and the US desires access to education and jobs, regional peace and security, respect for the rule of law and human rights, and the promise that our children would have a brighter future ahead of them. Building on the foundation that every generation is responsible to make sure that the succeeding generation is stronger and more capable than the preceding generation. These are goals that also align with our local, public, private sector, and development community partners, including the exceptional partnership with the Benjamin Mkapa Foundation. One of our greatest priorities that we share is how to best support Tanzanian youth. Currently, over 40% of Tanzanian population is under the age of 18. And the country's population is expected, according to United Nations projections, to double by 2050. The United States empowers Tanzanian youth in a variety of ways, including through educational and leadership exchange programs, such as the Mandela Washington Fellowship, Young African Leaders Initiative, better known as the YALI program, and the Fulbright Exchange program. The United States remains committed to working with local government, community members, business leaders, and the youth of Tanzania to build a supportive environment that enables the young people of Tanzania to reach their full potential. This requires investment in both access to quality education and creating employment opportunities. The health sector has been and remains a central priority of the U.S. assistance. In the last 20 years, in a single program, PEPFAR alone, the United States has spent over $7.5 billion in Tanzania, dedicated to the proposition that a healthier people in Tanzania will be able to be employed for a longer period of time and contribute more to Tanzania's growth and Tanzania's success. It is absolutely and unquestionably the case that a healthy and strong population is the best asset that any nation can ever have. And we have always been and will continue to be committed to the health of Tanzanians, because the health of Tanzanians is beneficial to the health of the global community, and as such, beneficial to the United States of America. We have been proud to partner with the government of Tanzania on a range of initiatives that have helped to contribute to dramatic gains for Tanzanians over the past 2 decades alone. There have been huge decreases in the under 5 mortality rate, huge decreases in the maternal death in childbirth. Someone already said that no parent should die while having a child, and we believe that that is the case. There have been huge decreases in malaria in Tanzania, and at the same time there have been huge increases in the life expectancy of the average Tanzanian. Some reports have indicated that the life expectancy of the average Tanzanian has increased by 15 years, not only because of the help that the United States programs have provided, but because of the help that the global community has provided, working as partners, not in front of or behind, but alongside of Tanzania, and also the work of the international community through the United Nations programs. I am proud that the United States government has partnered with the Benjamin Mkapa Foundation through one of the major programs of sustainable health to increase the ability to address the human resources gaps in Tanzania. Thanks to the Mkapa Foundation and other USG partners and global partners, the USG has contributed to the deployment of over 20,000 health professionals in over 800 health facilities across many parts of Tanzania. Over 80% of the eligible healthcare workers have transitioned to meaningful employment in the government of Tanzania. The reality, however, is that the government of Tanzania and no government can afford to be able to hire enough people that it will be required to maintain good and steady health. The private sector must be invigorated. The private sector must grow alongside of the government in order to provide meaningful health care for all Tanzanians, and also in order to provide the ingenuity and insight that comes from research institutions. Much of the research that is stimulated in U.S. hospitals and U.S. research centers is funded through private sector philanthropy. It is essential for Tanzania, as Tanzania continues to grow, to have a robust private sector with a robust philanthropic institution that will be able to support the great work that this nation is doing. One additional note, Tanzania is not only taking care of Tanzanians. I was visiting last week some of the camps for refugees from the DRC and from Burundi, and watching the outstanding work, outstanding commitment of Tanzania alongside of the U.S. and other development partners to take care of people who have come to this country as refugees, taking care of their health care and taking care of other parts of human development. I applaud the Tanzanian government for having a long track record of being generous and being able to provide health for others. May God continue to bless Tanzania. May God continue to bless all of us now and always. Thank you so much.